I'm Dr. Vic Sahakian. I'm the Chief Medical Officer at Pacific Fertility Center. In this next educational video, I'm going to be talking about egg freezing. It would be helpful if you refer to another video we made about the female and male reproductive system that will segue into this egg freezing video. Egg freezing. All right, so until recently, a few years ago, we weren't able to freeze eggs well. But technology advanced and we started using a technique called vitrification, and we are able now to freeze eggs fairly successfully. So who needs egg freezing? As I mentioned in the previous video I made, if you watched that video, we talked about age and its effect on egg quality. As a woman gets older, the quality of the eggs decline. You have less normal eggs, you have less eggs, less normal eggs. And as you get into your early 40s and after 43, it's almost impossible to get pregnant because you don't have enough good eggs. So to basically help increase a woman's chance of getting pregnant, imagine if you could freeze young eggs in time, which means if you're 28 and you know you're not going to have a child for the next 6-7 years because of your profession or you haven't found the right person, whatever, if you froze those eggs at the age of 28, you have a better chance of having a baby than at the age of 44, let's say. Why? Because if I took 10 eggs at 28, half of them are genetically normal. But if I took 10 eggs at the age of 40, one is normal. So if you freeze eggs at a younger age, you increase the odds of having more normal eggs than years later. That's the reason why women freeze eggs, to preserve fertility, to increase the odds of getting normal eggs at a younger age than an older age. So since we have now the technology to freeze eggs, a lot of women are freezing eggs. And it's best to freeze eggs when you're younger. So yes, 25 is better than 28, 28 is better than 35. Is it too late to freeze eggs in your 40s? Probably. Why? Because you need to freeze 100 eggs to get, let's say, 5 normal ones at 43, 44. So to get 100 eggs, you're going to do tons of cycles. So just not cost effective, doesn't make sense. Versus at the age of 28, 29, where you could do one cycle and get like 20 eggs and have enough eggs to have a good chance of having a baby in the future. So egg freezing is best suited for women under 35, 36, so between 35 and 40, and probably not a good idea over the age of 40. Although eggs frozen at 40 will give you a better chance than eggs you produce at 45. So there is an advantage of freezing eggs probably all the way to the age of 40 to 43 if you're making enough of them, but better to freeze them when you're younger. So how does this egg freezing process work? So the first thing you do when you see your physician and you say you're interested in egg freezing, the doctor is going to do a couple of tests. He's going to do an AMH test, which stands for anti-Mullerian hormone. But most likely, the most important test is going to be an ultrasound, a vaginal ultrasound, for an antral follicle count. This is where we go in, we look at the ovaries through the ultrasound, and we count, quote unquote, the eggs. Now, we can't see the eggs on ultrasound, but we can see the little follicles where the eggs are contained, because those you actually can see on ultrasound. They're little balloons filled with fluid that contain the egg, and they're in the ovaries. And you can do an ultrasound, preferably in the beginning part of the cycle, and count these little follicles. These antral follicles the number of them will go down with age. So if you have 50 of them at the age of 20, at the age of 40, you're lucky if you have 7 or 8. By counting these follicles, we can give the patient a good idea of how many eggs we can obtain from her if she did one cycle of egg freezing. Because the number of follicles translate into number of eggs. So how can we get these follicles, these eggs, out and take advantage of youth to accumulate eggs and freeze them? So in the natural cycle, and I'm going to draw this, which will make it very much understandable. So here is one ovary. And in a natural cycle, you have bunch of little follicles called antral follicles that will start growing. This is day one of the cycle. Day one is the first day of your period. So the brain secretes a couple of chemicals called FSH and LH. These chemicals go to the ovaries, to blood, and wake up a batch of these follicles from day one of your cycle. So then what happens, by the time you're at day 4, one of these follicles becomes dominant, and then we're going to keep going here to, let's say, day 7. This follicle that becomes dominant kills everybody else, and by day 7 you have follicles that are dead, and you have this dominant follicle with an egg inside that's growing. And if you continue another week, by day 14 of your cycle, now you have one dominant follicle with an egg that's released. That's a natural ovulation process. So look what happens when you do an egg freezing cycle. We will give you these chemicals in the form of fertility drugs in higher quantities starting on day 2 of your periods. So your period starts, on the second day you'll be doing these hormone or chemicals injections every night in the abdomen, little needles, very easy to do, for about 10 to 11 days. So what happens when a woman takes these chemicals in larger quantities than intended, than what you make on your own? Well, look what happens to these follicles. So these follicles that in a natural cycle are growing and one becomes dominant, now you can see something interesting happening. So these drugs will basically stimulate these small follicles that otherwise would have died to grow and reach maturity. This is the process of IVF, of egg freezing. This is the concept. Giving the woman higher amount of the chemicals that the body produces to salvage or rescue eggs that otherwise you would have lost. So when you do an egg freezing cycle or an IVF cycle, the eggs that we are able to rescue are eggs that otherwise you would have lost. Hence why when you do IVF, you don't run out of eggs. You don't go through menopause any sooner. It doesn't affect your future ability to have babies. So egg donors who donate eggs can do this multiple times without any bad outcomes or bad sequelae for the future in their own ability to have kids. So egg freezing and IVF is really a rescue process of basically salvaging these eggs that otherwise you would have lost that month. Now, the amount of eggs we can salvage depends on, 1, age. The younger you are, the more follicles you have, the more we can salvage. 2, depends on the amount of drugs we give you. Fertility drugs. There's a ceiling though, above which you can't produce more eggs. So typically, a very good egg producer will produce somewhere between 50 to 100 eggs. That's huge numbers. Average would be somewhere around 20 to 25, depending on age. The older you get, the less eggs you produce. So the younger you are, the more eggs you're going to produce. The more drugs we give you, the more eggs we can salvage with a ceiling. And finally, genetics. Not every woman is going to produce the same number of eggs at the same age. So one 25-year-old could produce 30 eggs with the same amount of drugs versus another one who's going to produce 18. And that's genetics. That's where there's a variation between patient and patient. But when you're doing an egg freezing cycle, when we talk about stimulation protocols, we talk about drugs you have to take, understand that the whole purpose of egg freezing is to freeze eggs at a younger age. The more eggs you freeze, the better the chances that you're going to have a baby. And the process is very quick. And if I put a timeline so that you understand how long does it take to do an egg freezing cycle, you will appreciate it. This is the timeline. This is day 1 of your period. On day 2 of your period, you will start taking fertility drugs. We're going to call those stimulation medications, okay? You will take these every night, 8, 9 p.m. And the reason we do it at night, not because it affects outcome, it's just because it's better at the end of the day when people are not working and they can do these. So you will do these injections typically, so 3, 4, 5, 6 or 7 days before you come in for an ultrasound, okay? On the 7th day usually, some doctors will do an ultrasound on the 4th day, but typically on the 4th or the 7th day of these medications that you've taken every day, so this is medications taken every day, on the 7th or 4th day you'll have an ultrasound. What's the purpose of ultrasound? Well, remember, this is the ovary. You're starting with small follicles on day 1. Under the influence of these stimulation medications, these follicles are growing. And the doctor will measure these follicles and count them. And then will typically ask you to come for another ultrasound 2 or 3 days later. So here we are doing another ultrasound. These are 10-minute visits. So 1 or 2 ultrasounds, you're continuing the medications. We are now measuring these follicles that are growing. At some point, usually 10 or 11 days after taking these injections, these follicles will reach a certain size that we believe they're mature enough to harvest them. It's like grapes. You have little grapes, you give them some time, and then once the grapes are mature, you got to take them out. You got to pick them up. If you don't, the eggs will become post-mature, will be bad eggs, and you lose them. Or if you go too early and take the eggs too soon, then you're going to have immature eggs. So at some point, usually 10, 11 days after taking these medications every night, your doctor is going to say, hey, your follicles are ready. You have the right size. We need to do an egg retrieval. The egg retrieval is done typically 2 days after the last day of medication, okay? And this is where you will undergo a procedure which we call egg retrieval, which is basically harvesting of the eggs. So let me show you how an egg retrieval is done, which is again, roughly 13, 14 days after you started these medications. You will be told to come to the office. We ask you not to eat or drink anything after midnight because we do it under light anesthesia. You're put to sleep, and under ultrasound guidance, we insert a needle. You don't feel any pain. It takes 10, 15 minutes. A needle is inserted through the vagina into the ovaries, and we aspirate the fluid from inside the ovaries, and the egg will come with the fluid. So now you have a puncture wound into the ovaries, aspirate all the follicles one by one. We aspirate this, we go back, go this, 5, 6 minutes per ovary. We're done with one ovary, we go to the next ovary, and we keep basically aspirating every follicle, hoping to get all of the eggs. Now, each follicle typically has 1 egg, no more than 1 egg. However, some of them are empty, some of them have bad eggs. In general, the number of follicles you have at the end of a stimulation cycle that look mature and healthy is the number of eggs you're going to get. So once this procedure is done and the eggs are aspirated, they go to the IVF lab. And if you're doing an egg freezing process, basically those eggs are cleaned and frozen. They can be frozen forever until the time you need to use them. I will come about some statistics in a second, but let me tell you some of the possible complications from this procedure of egg retrieval. This is done under anesthesia, so you don't feel any pain, but it's a needle. It's a needle that goes through the vagina. It's like having blood drawn. So anytime you have a blood draw, as you probably know, you have to put some pressure to stop the bleeding. Same here. There's always blood that comes up once I take the needle out. We just put some pressure and we stop the bleeding. Sometimes you get bleeding from the surface of the ovary, and some women will have some discomfort and pain afterwards for a few hours because of that blood irritating the abdomen. Because it's a needle, there's always risk of infection because this is dirty, this is sterile. So we give you antibiotics, we pretty much never see any infections. And theoretically, this needle can damage any organs around the ovaries, and it doesn't happen simply because we are looking through an ultrasound to see where this needle tip is going. So these are the most common complications that can happen with an egg retrieval. So final thoughts about egg freezing and some numbers that patients are interested to know. The younger you are to freeze eggs, the better you are. Typically, the younger you are, you need less eggs to freeze because most of your eggs are normal at that age. So ironically, you make less eggs as you get older, hence why you need to freeze more eggs as you're older. So as a typical number, at the age of 30, let's say, 20 eggs is considered as a good number to freeze. And if you get to 40, I would recommend even more than 30 eggs, but that might require multiple cycles. So when you do one cycle of egg freezing, you're going to get an X number of eggs that you actually can predict by an ultrasound before even you start the process. So if you do an ultrasound for an antral follicle count, and I count 15 follicles, I'm going to tell you we probably will get 15 eggs. And if you're 38, I probably will tell you you need to do 2 cycles so we can get those 30 eggs. And if you're 28 and I do an ultrasound and I see 35 eggs, I'm going to tell you, listen, you need 1 cycle and you'll have enough eggs for a baby in the future. So eggs can be frozen indefinitely, as far as we know, and you can thaw them anytime in the future, fertilize them, and create embryos to have a baby. What I always say to my patients that what you freeze is an insurance policy. You hope to never use these frozen eggs, and you will only use them if you basically fail and you did everything else possible and you failed to have a baby. Then you resort to these frozen eggs. So this was a summary of the egg freezing process, but if you want to learn more about it, please call the office and make an appointment. We'll be happy to talk to you in person.